With that, I'll turn it over to Dr. Mascola, who can elaborate further about what we know and don't know about this virus.
Again, what we've said to date is that there are about 40 cases throughout the nation. There have only been 2 that have been hospitalized, and there have been no deaths. The illness is really presenting as a low, serious disease with an incubation period of about 2 to 4 days. It's a very mild influenza-like illness occurring in the United States. We have seen it in the states that have been mentioned, New York, California, Texas, Kansas, and Ohio. There are other countries that have also seen cases, mostly linked to travel to Mexico. At this point in LA County, we have no confirmed cases of swine influenza. I repeat, there are no confirmed cases of swine influenza. We are still seeing seasonal influenza in LA County. As early as last week, we did have some outbreaks of seasonal influenza type B in some schools. So again, not everyone that coughs is going to have swine flu. There still could be the possibility of regular seasonal influenza, which is why we do encourage people who haven't gotten vaccinated against influenza. There's still an opportunity to get vaccinated against seasonal influenza. We are investigating 2 clusters of outbreaks, again, in the same area where we saw seasonal influenza last week. It still could be seasonal influenza. We will be obtaining specimens from these clusters. It will take anywhere from 2 to 4 days, depending again. First, when we get the specimen, we have to see whether or not it is type A or B. If it does get typed as type A, then we have to see whether or not we can type it to be one of the regular influenza specimens. That usually takes 24 to 36 hours. If it is a non-typable type A, then the virus specimen is sent to the state laboratory and then to the CDC. So again, even from specimens that we are seeing today, it might take anywhere up to 4 days to confirm if we truly have a swine flu case in LA County. It really doesn't matter though if it's swine flu or regular flu, because the recommendations at this point are the same with respect to hand hygiene, social distancing, covering your cough, sick people staying home, not going to work, not going to school, the same messaging that we usually use for seasonal influenza. Actually, there's a little difference with respect to treatment. For those of you who may not remember, for seasonal influenza, there was some resistance to one of the types of the seasonal influenza to oseltamivir. Swine flu influenza is sensitive to oseltamivir. So again, if you as a clinician did have a severe case that you thought was swine influenza, you can begin treatment with oseltamivir. Again, that is the only difference really in knowing whether or not it is swine flu or regular flu. The other precautions, we're not isolating anyone, we're not putting anyone on quarantine. It's just the usual good recommendations of not going anywhere if you're sick, staying home. Same thing for schools. Don't send your kids sick to school. Don't come to work sick. Cover your cough, and wash your hands frequently. We are doing enhanced case surveillance. Again, we were at the tail end of our flu season, so we weren't doing, a lot of activity looking for influenza, but we are now. We're calling all the hospitals and writing them and telling them to call with any severely hospitalized person with influenza. We're working daily with the coroner's report and with our daily death certificate supply. We're looking at clinics and other private doctors to call us if they think they have a case of a swine influenza. So again, there are some recommendations that are being sent out to physicians, to hospitals, to clinics. Another major thing that's important to say is, again, if you have people in skilled nursing facilities, we're asking them not to let people come into those facilities as visitors if they're sick. Again, just good recommendations not to do even if it wasn't swine influenza, so we don't spread the disease to the vulnerable population. We're also working obviously with the school districts. We're working with other vulnerable populations such as the homeless and other at-risk populations as it relates to either finding cases or getting messages out to those people about how to avoid getting sick.